the injuries at the hospital. Away from that, and this year's Mashujaa Day, celebrated in Kericho and presided over by President William Ruto, will be remembered for one thing: the launch of universal health coverage, commonly known as the UHC. The program, one of President Ruto's main election pledge, promises to reform the health sector and offer free health services through a reformed national health insurance coverage. Addressing thousands of Kenyans, President Ruto affirmed his unwavering commitment to ensure that all Kenyans, regardless of their social status, have access to the highest attainable healthcare services. Ruto emphasized that primary healthcare will be freely available to everyone, and for those unable to afford it, the government will shoulder the financial responsibility. Beldenwali Aula reports from Kericho provides the latest updates.
Newly recruited community health promoters swearing to serve Kenyans under the universal health coverage. The government hopes that each CHP will serve at least 100 households in Kenyan villages. The move, according to President William Ruto's government, will help push for preventive rather than curative health care. The community health promoters are expected to provide level 1 care treatment. Each of the CHPs will be equipped with kits containing various tools for screening blood pressure, hypertension, and diabetes, as well as supplies of painkillers and other essential medicines. The 100,000 trained and deployed CHPs will also have a smartphone for purposes of keeping data. The officers will receive a monthly stipend of 5,000 Kenyan shillings. The cost will be shared with county governments, ensuring the sustainability of CHP program and emphasizing the value of investing in primary health care.
I promise a fully publicly financed primary health care system, an emergency care fund, and a health insurance fund that will cover all Kenyans.
Ruto expressed confidence that after several unsuccessful attempts at implementing UHC, the new laws in place will make a difference. These laws include the Social Health Insurance Fund, Primary Health Insurance Act, Digital Health Act, and Facilities Improvement Financing Act, which he assented to on Thursday.
And access to health care from now henceforth will no longer be based on ability to pay. It will be based on the health needs of every Kenyan.
The head of the enacted Digital Health Act will guide in the collection and use of household data and health facility information.
Quality community health data is essential for the planning, resource allocation, and monitoring of progress towards universal health coverage. The government is committed to delivering on the digital health agenda, starting from the community level.
Ruto took pride in signing the bills into law, highlighting the paradigm shift to the Social Health Authority and the repeal of the NHIF Act. He asserts that this change will provide Kenyans with the health care they need. Employees will contribute a certain percentage of their income to prevent inequity, and the specifics of the premium payment modality are yet to be defined, as the government considers adopting a household payment system.
Every citizen pays for health a percentage of their income, an equal percentage of their income, so that we can equalize the fortunes of every citizen with respect to access to health.
As the government strives to strengthen healthcare across the country, hospitals will have autonomy in utilizing funds collected to enhance service delivery efficiency. With UHC, the Kenya Kwanza government aims to fulfill its manifesto promise of healthcare for all. Belden Waliaula, KTN News.
Meanwhile, President William Ruto has fired a warning shot at corrupt individuals in his government.